Hi, welcome to 843 TV. I'm Catherine Madiman, your host. And today we're going to have some good information on how we can handle the coronavirus, which is actually affecting us here on Hilton Head Island. Today, our guests, we have Tom Bouthillet, who is the Battalion Chief of EMS, and we also have Heather Rath. And she's also going to give us some information about ways of doing business here on the island, a lot of online services. And stay with us. We'll be right back with more 843 TV, where communities come to speak.
.843 TV, where the Low Country comes to speak.
.843 TV,
where communities come to speak. And welcome to 843 TV. And I am with Tom Bouthillet, who is the battalion leader for the EMS crew here on Hilton Head Island. And I'm really excited to have you here because we have some serious matters on our islands called the coronavirus. And you guys are first alert. You guys are the first response people. Tell us what's going on in the last 2 weeks since I've been on air.
Things have been kind of quiet. We're running some calls. Obviously, we're taking the respiratory calls and flu-like symptom calls very seriously. But overall, calls are down. I think a lot of people that normally would go to the hospital or dial 911 for one relatively minor or moderate complaint or another, they are not calling 911, and that's actually a good thing. So I would say we're in the lull before the storm, which has given us an opportunity to refine all of our policies, all of our procedures, all of our training with our PPE and our donning and our doffing, and even the handoff at the hospital and different things like that. And we've been able to take advantage of this time to streamline process to keep our people safe, and I think that's been a real benefit.
Interesting. So you're saying, before the storm, are we still predicting that we're anticipating the island to be affected more than we are? I think we have like 60, what the numbers are, I'm trying to remember.
Well, okay, so if we look at the numbers from yesterday, if we take, let's say, just Hilton Head Island, this is really important what DHEC did yesterday. Yeah. They show, if you look by zip code, so 29926 and 29928, we only have 16 confirmed cases on Hilton Head Island. However, there's a new column in this information from DHEC called estimated cases. And the estimated cases are about 98 for Hilton Head Island. And I think it's really important that DHEC did this because what it shows is the number of confirmed cases is not an accurate reflection of the true number of cases of COVID-19 in the community. So have we peaked yet? Absolutely not. We have not peaked yet. And so yes, our healthcare system here locally is going to be affected by COVID-19. There's no doubt about it.
All right. So a couple of things we want to talk about. First, face masks and gloves. I know now going to the grocery store every 2 weeks, I see a lot of people are now wearing their face masks, and that's a good thing.
It is. So now Dr. Anthony Fauci, the CDC, and Hilton Head Island Fire Rescue are urging everyone that goes out into public that is going to be 6 feet away from other people or less, so you're having trouble maintaining that social distance, that they should be putting some type of cover over their respiratory openings, so their nose and their mouth. Mm-hmm. And the reason is just speaking like I am right now creates respiratory droplets. And we know that those droplets can travel up to 6 feet and then they fall to the ground. Okay? It's really difficult for asymptomatic people to understand and wrap their mind around the fact that they may be transmitting this virus because they feel fine. So just keep in mind, someone that tests positive for COVID-19 today was likely exposed to the virus 2 weeks ago. They had to go through an incubation period. They had to get sick enough to see a physician. The physician had to say you qualify for a test. You had to get a nasopharyngeal swab called a PCR test that had to go off to the lab with a turnaround time of 2 to 7 days. So this data is old by the time we're finding out about it. And so these little spot fires indicate that we are having a problem in the community. We should not look at that as this is all that's here. We should look at this as an indicator that COVID-19 is here.
And we don't know who they've touched and so on and so on. It's a bit overwhelming and a little eerie to be for sure, So when we think about the people who have the coronavirus, are they at home? Do we know if they're at home? Are they self-quarantined? Do we know if they're in the hospitals? Do we know anything about that?
Well, we hope that they're home. 80% of people that contract COVID-19 are going to be able to tough it out at home if you look at the data that we have.
Good.
Now, that doesn't mean that they're not, it doesn't mean that they're not sick. I mean, you might have bilateral viral pneumonia, but you're able to tough it out at home with your fever and with your cough, for example. So it doesn't mean that you're not sick. It means you're convalescing at home. 20%, however, are going to need a little more support from that. That may just be supplemental oxygen at the hospital, or it could mean critical care. Up to 5% of these folks may actually require a ventilator in the ICU, and that's why it's so important that all of us do our part to help flatten this peak that everybody talks about. We're going to delay and flatten this peak to keep this outbreak at such a level that our local healthcare system right here in Beaufort County is able to handle the situation with the number of hospital beds, with the number of ICU beds, with the number of ventilators available, and the number of nurses, frankly. I'm very concerned for our frontline healthcare workers during this outbreak.
Yeah, exactly. You know, it's like envision it sort of like, you know, when you have a forest fire and they dig a ditch so it doesn't jump over.
Yeah.
So that's what we want to do, is create that ditch. You want to have that space, so
That's right.
we don't want it to jump over.
Correct.
You know. So let's talk about the masks, because you have a lot of masks in front of you. Are those homemade? Because, you know, at the stores, we can't find gloves, we can't find masks, we can't find toilet paper, we can't find Purell, we can't find a lot of things. So how can we help ourselves?
Well, there are a couple of different mask-making consortiums in the community right now.
What is that made of?
Well, most of these are cotton masks.
Okay.
Some of them have a little insert where they've added additional filtration on the inside. But whatever it is, it could just be a bandana and a couple of rubber bands. The U.S. Surgeon General put out a video that shows how to make a mask out of a bandana and 2 rubber bands. Any type of facial covering in front of your respiratory openings is going to catch those droplets when you're out in public.
Right.
This is a very nice mask. Some of them are actually very stylish. My wife's is Paisley, and she likes her mask. I would say right now there's an urgent need to connect members of the public that are going to be out there at grocery stores and things of that nature with a mask. Or they're going to have to figure out how to make their own mask at home. But I think it's very, very important at this point, when we're out in public, that we wear a mask and observe impeccable hand hygiene. I'm not a big fan of the gloves, okay?
Yeah, and why is that? That's interesting.
Yeah, so the gloves, if you're using gloves for medical reasons, it's because I'm in your room or you're in the back of the ambulance, I'm taking care of you, I'm wearing gloves, and the moment I'm done taking care of you, I doff the gloves and I do proper hand hygiene right after that.
Right.
They were not ever meant to be worn for a long time throughout the day. At that point, it's no different than your own fingers, your own hands. You're touching the virus, you're spreading the virus around with your gloves, and because you're wearing gloves, you may not be doing frequent hand hygiene. So it's way more important that you wash your hands frequently, or even with an alcohol-based hand sanitizer, than think that this extra layer over your hands is conferring a benefit as far as transmitting COVID-19. It's not doing that just because you're wearing gloves.
Right, it's all about touching your face. It's all
Yes.
about putting your hands in your face. I think that's the
Absolutely.
biggest thing that we can do. So what else can our community do to help ourselves? Because we want to make sure we stay safe.
Right. We did a lot of smart things in March, okay? We canceled the St. Patrick's Day parade. We closed the schools. We shut down the dine-in restaurants. And we limited access to the beach. And if you remember, it was spring break. So all these things we call broad mitigation strategies. And these were gut-wrenching decisions for our state and local leaders. These things have a large economic impact, but they were the right thing to do during this public health crisis. And I shudder to think what our local situation would look like today had we not done those things in March. And I strongly believe that the things that we continue to do in April are going to have a lasting impact in May and June in terms of our healthcare system's ability to deal with COVID-19. This is not a time to let down our guard. It's not a time to have a dinner party at your house and invite your neighbors over. This is not the time to let your kids play up and down the street with anybody else's kids. It's not time for an innocent card game, because what can happen is you might transmit COVID-19 to someone, they in turn are going to bring it home and infect their entire family,
Right.
and it's going to turn out that a member of their family was an ER physician or something like that, someone on the front lines that is going to expose their coworkers to this. So by all buckling down and observing this social distancing for the rest of April for sure is going to have a lasting impact to the local situation on Hilton Head Island and Bluffton. In fact, all of Beaufort County for the next 2 months. So this is a very critical time because we have not peaked yet.
Yeah, so April, May, June. So we're thinking the peak could come around June now, or are we thinking we don't know? It's
We're
all-
not entirely sure, but keep in mind, even if we're successful, and I think we will be, in flattening this peak,
Yes.
okay, and then let's say it even crests a little bit. That's really important because it means that right now, instead of one person with COVID-19 infecting 2 or 3 other people, that's how we have this exponential growth. The social distancing, we're hoping to keep the so-called R0, or the number of additional people you infect, it has to be below 1, okay, below 1. And so with the social distancing, if I get COVID-19 but it stops with me, I don't infect my wife and my child, and I don't infect my next door neighbor, it just stops there and it's gone, I recover and I'm no longer contagious. That's how ultimately you defeat COVID-19. And so we'll be able to see that in the data when we're starting to come down the backside of this peak, but everyone needs to understand, we don't flip a switch and go back to normal right away. We could have a second peak, for example. So once we start to unlock the economy and people start going back to work, this is going to have to be a graduated thing that is done very thoughtfully and very carefully.
You know, Tom, I want to thank you so much for this, your time and all this wonderful information, because it is a serious matter to our island, and we want to make sure we protect ourselves, self-care, take care of our families and our friends. I think you're right. Be patient. Make it into more of a habit than versus it just saying, okay, now we can go back to the old ways, you know?
Correct.
So I have to say goodbye to you now because we have just ran out of time, but thank you for joining me. And please, any information you need, go to the websites, right?
Absolutely. The town of Hilton Head Island has a great coronavirus page
Okay.
with lots of good information. The CDC, the World Health Organization, I would say do your best to get solid sources of information. The South Carolina DHEC page, things of that. There's a ton of conspiracy theories out there in social media.
Yeah.
There's a whole bunch of debate about what drugs look promising and why and things like that. I would just say a vaccine for sure is about 18 months away. And
Okay.
it's going to be herd immunity and a vaccine that really makes COVID-19 manageable. So this is going to be a marathon. It's not going to be a sprint. But if we all work together, we can ensure the health of our community as we go forward.
Well, thank you so much. And please stay with us because we'll be right back with more 843 TV. We have Heather Rath with us.